be back on. So I wish they won't let you change it while you're already in there.
They're gonna have to fix that. Can y'all hear me now? Hi. Hi, Becky. Yes or no? Sound? Can y'all hear me? Is there sound? Can you log
I can see
on?
sound
Oh,
there.
oh. Thumbs up. So I think that means we have sound. Okay. You were just on Instagram, Becky? Yeah.
Yes.
Okay. Yay. Hi, everyone. Welcome. Welcome, welcome. Grab your lunch, grab your snack, grab your meal, grab your water, whatever. It is our weekly. We're going to hang out. We're going to chat. We're going to eat some grub. We're going to gab a little bit. No sound? Happy Monday. Happy Martin Luther King Jr. Day. Hi, Amy. I think what's been really fun about this is that I see so many of y'all come back every week. I love that like community, that it's been. I'm recognizing a lot of y'all's names because you show up every time. So um, you're from Australia and always had trouble, yeah. Because I'm not even gonna pretend to know what the time difference is with that, Becky. Um, Hi, yay, welcome. Hi, everybody. You're feeling really emotional today. You're crying so much. Girl, or I would assume you're a girl. I'm sorry. Um, I try to, pronouns are things. So, me too. We've had quite some losses here in my home. And it's been really, really hard. So we're very emotional here in my house too. Um, but I'm here today. So 5 a.m. in Australia. Woo! That's early. That's really early. Do you normally get up this early? I'm new. Thank you for doing this. Well, thanks for being here, Kirsten. I'm so glad you've joined us. Oh, body checking without thinking about it. I was gonna do like a video on this, kind of like body checking, um, little things that we do to body check. And what's happening is it's an anxiety release in a way. Like we're anxious, and we kind of like focus and tune into our bodies, and then the body checking behavior becomes a way to quickly kind of try to release that anxiety, but it doesn't. Right? It doesn't work. Um, it works just in that moment. But that's the thing with like all coping skills is they kind of just get us through the moment. So I teach people to care for themselves. Like, how can you just show up to be kinder, compassionate, her, whatever? How do you care for yourself? That's what I teach people because we all have feelings for different things and our bodies feel those things. So um, it's not always so easy to just like feel good about your body or feel good in your body. So how do you just care for yourself even when you're really, really struggling? Like we've been in my house these last few weeks. How do we take care of ourselves? Um, you feel the F word. So it does feel like a feeling, but it's not really a feeling. So if you ever feel that way, the dreaded F word, and I'm saying dreaded F word because this is an eating disorder recovery safe space, right? Um, so if it's not a feeling, like a true emotion. So it means if you're feeling that way, you have a lot of emotions going on. So can you go a little bit deeper and acknowledge how you're really feeling, because your your feelings are okay. So how can you care for yourself to deal with that feeling or to work through that feeling? You're doing a food texture challenge today, the caffeinated sloth. So, all right, caffeinated sloth on Instagram, but anybody, because we're here on TikTok, we're here on YouTube, Facebook, we're on all of them. So everybody give caffeinated sloth just like some high five. You got this. Food challenges can feel really scary, and it takes a lot of courage. So proud of you. Have I ever worked with anyone that overuses laxatives? Yes, because let me say this. How do I say this concisely? Let me take a bite while I think about how to say this real quick. Okay. So there are different types of eating disorders, right? And they're classified only because they involve different types of like behavioral characteristics. But all I treat eating disorders all the same. So things like laxatives, exercise, the food, behaviors that you use, they're they're behaviors of a disease, right? And so I approach it from that aspect of like the disease aspect, that it doesn't matter what specific behaviors you're using. Like you can do things to learn how to manage specific behaviors. Like behavior can change. We're humans, right? So the work to treating eating disorders is getting behind the behavior and why we so it's treating that. So I so like when people reach out to me like I do this behavior and can I have more information on this behavior? Well, sure you can, right? Because I want people to be able to talk more about these things, but know that like I'm speaking to anybody that has an eating disorder because it's not about the behaviors, it's about what's driving the behavior, the emotion and the trauma and the psychology and the mental stuff that's driving the behavior. Behavior we can change. What makes long lasting true change and recovery is addressing those underlying things, right? So that's what I care about. I can see my comments, but they go really quickly sometimes. So I'm trying, so when I'm like answering a question, I might miss some of y'all's comments and questions, but I'm sitting here looking at a board with all of them. So I should be able to see them. Like I see, food challenges are my favorite because I feel, and then you got cut off. But I'm thinking that it's your it helps you grow. It helps you see how far you've come. Katie on TikTok. Do I know what intensive PHP for EDs are like? Do you have a specific question about a PHP? I hate talking with a mouthful of food because I'm in Texas and my mama taught me that was against manners. Mm-hmm. PHP stands for Partial Hospitalization Program. Um, and that signifies the amount of time per day that you're in programming. And so if you're in a partial hospital program, you're in programming most of the day, most days of the week. What's different than PHP versus residential is that there's more freedom to like leave. You can have a little bit more independence. Sometimes partial people can live at the program. It kind of depends on the place that you're at, but that's the difference, right? Intensive partial means you're there and you're doing a lot of therapy and a lot of group and you're getting a lot of support, but maybe there's a meal that's left on your own. Will they force feed you? That depends on you. Okay? That depends on, no, they're not going to force food down your mouth. They're teaching you compassion. They're teaching you care. They're teaching you how to not be afraid of food. So they're going to model behaviors around eating that help you feel like you can complete your meal plan. But when I say it's up to you if they're going to force feed you, it is true that sometimes people have to step up to higher levels of care. It is true that sometimes getting a tube is necessary in recovery. And so it depends on, your ability to tolerate the meals that you're working on with your team. If the program's recommending partial, they have talked with you and they've assessed you and they've determined that you are okay and can kind of do things independently, but you also need a lot of help and a lot of support. So that's what they're there for. So yes, partial programs are very great. They are great if residential isn't an option. Sometimes people don't need to go straight to partial or straight to residential. Sometimes you can just start in partial. So, yeah, want to. What do we say to family when they threaten to force feed you? Man, that sounds really scary and really hard. That sounds like a high pressure environment. Get them talking to your team, right? Let your therapist have a conversation, dietitian, doctor. They need to not make it so scary. They need to learn how to support you during meals, but also know that, like, if tube feed is an option, when people aren't able to complete meal plan, it doesn't mean because it's something you can't do. Like sometimes we get so sick, and sometimes like things just happen physiologically, and or with health, disease, all kinds of things. So it has nothing to do with like you as a person. But when we get sick, sometimes tube feeding is an option. Mm. Your if y'all have parents that don't get it, it's not your job to educate them. Like you are still learning what you're going through. You may not even know what you're going through. Get your parents to talk to your team. Let them talk to a doctor. Let them talk to a therapist. Let them talk to a dietitian. Mm. Oh, Kirsten, you asked a good question about laxatives and going cold turkey. So before I get answered, let me say something. I am not your doctor. I'm not treating anybody, and please do not see this as medical advice. I want you to call your doctor, tell your therapist, tell your dietitian. You can come off of laxatives when it's been abused, but it is something you want to try to do with a medical team so that you do it safely. So please um, start with your doctor if you don't have a team. Hard to find in Texas? No, it's not. We're in Texas. We treat eating disorders. There's lots of specialists in the state of Texas. If anybody like Texoma Specialty Counseling is my private practice. We treat eating disorders. So finding help for an eating disorder in Texas is really not hard because we're right here. But with that being said, I know that there are lots of places in our country and in our world that do not have any eating disorder specialists, therapists, coaches, treatment options available, which is why I've created the Recovery Academy. It's also really hard to tell people that you have an eating disorder because of shame and stigma around the disease. That's another reason why I created the Recovery Academy. and I see an issue for not getting help is money and no insurance, which is why I created the Recovery Academy. It is a low, we're talking like the cost of an insurance copay per month. It is a low cost support recovery option. I teach members of the community everything I know about the treatment of eating disorders. We address specific topics and issues, and then I kind of hold the community's hand as we work through and talk through that issue, that topic. There's also live support groups every week, lots of opportunities to come together and gather. And we also have like if you're needing like individual, that's an option. So Recovery Academy, if anybody wants to see if that is an option for anybody needing, some help or support. You can join the Recovery Academy if you are in another country. It is not just for American, Texan, North American. It is anywhere where you have internet access and can go to recovery-academy.com. But it is an on-demand eating disorder recovery community, support community, right? So it's wherever your cell phone is. That's the recovery. That's where the Recovery Academy is. All right, let's see. Sometimes we need accountability. Doesn't mean it's easy. Mm. Yes, there's lots of PCOS spaces. Let me think of one. Um, mm, I don't have my on Instagram, Amy. Um, I think if you look up PCOS therapist, I'm pretty sure that's her name. You might find somebody, and she may have a Facebook group. I think she does a lot of education about PCOS and eating disorders. Mm. Wow, some of y'all are really struggling and having a really hard time. And let me just remind you, it's okay to ask for help. Like, if you're trying to do this on your own, you're going to be really struggling for a really long time. Katie, you're right. Take medical leave is an option for people. If you have to go to treatment, um, some people have the option for like family medical leave. That's a way to kind of keep your job, get a little bit while you're in treatment. You're asking about, um, am I saying that right? 1982 Christmas. So if you go to recovery-academy.com and have a free 3-part video training, those should come to your email. So the third video, like each video, should be emailed to you. So I would check there. Hmm. Katie, I see your question about getting a tube, and I don't know how to answer it because it sucks to be having a hard time in your eating disorder. It's really hard. And it's really hard to be that sick. And of course, you want to reduce pain. You want to not be uncomfortable. Of course not. And I want that for you. And I want you to know that if your treatment team has recommended something, it's okay to trust them. They have lots of training and lots of education. And um, if they think that a tube is what's best for you, that's going to feel really scary and really hard. and that's okay to feel that way because it could be it has been a life-saving treatment for people. Um, any resources for therapists who aren't ED specialists? The Recovery Dash Academy is a good one, but also I would check out IADEP, International Association of Eating Disorder Professionals. That's where you can look into that. Let's see, Miss Table games helpful in treatment. Yeah, like if you go into programs, like the people eating with you, they're gonna have lots of like. We know how anxious mealtime is, so we don't. Although we want you to learn to tolerate your anxiety, we don't want to just like throw you to your wolves and be like, "Good luck, eat that meal, John or Jane or whatever." You know, like we are gonna. They're gonna offer you things to like distract you, keep it fun, keep it light. So probably, hopefully, there's games, some kind of, I tell my clients, can you watch YouTube? Can you get on Netflix? Excuse me, hi Linda. So distraction can sometimes be helpful with meals. Becky on TikTok, I see your question, and I can't make another recommendation. Um, I would ask a dietitian or a doctor about that because I don't know another alternative. It's okay, Amy, to sometimes feel disconnected from our food. Like, is mindful eating important? Absolutely. It's important, especially like when we're trying to honor our fullness cues and kind of can be like just really good for us to be mindful and enjoy our meals. But so it's okay to be distracted if it's going to help you like connect and be with other people. I am going to take some bites to eat really quick because a lot of y'all are here eating and struggling to eat. So let's take a moment and take some bites and swallow some food. Take a minute to eat for a second, right? I'm here and we're all going to eat together, and it's okay to eat. Chelsea on TikTok, why don't you go to recovery-academy.com and get the free 3-part course in your email? I talk about how to stay motivated and focused in recovery. So I want you to go grab that. It's free. Hey, anybody feeling guilty or anxious right now? Tell that bitch to sit down. You've done nothing wrong. There's no moral value in eating. It's okay to eat. So whatever you just ate, whatever you're eating right now, it's okay. Aw, thank you. Aw, y'all are so nice. My mom called you an angel. Aw. Becky, you're worried what she'll think about your eating habits. Here's the thing. People are not spending that much time thinking about you. That might have been a really dickhead thing to say just then, but honestly, like, we're thinking about ourselves and our own shit and the shit that we are dealing with and things that are important to us. And so for somebody to be spending time judging the food that you eat, I think it says a lot more about that person than it says about you. Like it's not worth spending that emotional energy or any kind of energy on. Like who gives a shit? People are eating food. Okay, great. Thank you. Next, Ariana Grande. One thing I've learned is everyone is just trying to take care of themselves. We're all literally doing the best that we can. Now, sometimes we still hurt. And sometimes the best that we can doesn't meet our need. That's why we have to learn about ourselves and gain awareness for ourselves so we can ask and help people help us meet our needs, but also so we know how to get those needs met. We know how to take care of ourselves. It's all about boundaries, right? Mm. Right. It's that anxiety, right? And to that, anxiety is always a liar. I have a lot of anxiety. I deal with anxiety every damn day. And um, so I know what I'm about to say is hard. It's not easy, but some days you have to almost say to your anxiety, sit down. I know you are worried about these things, anxiety, but also I got just sit down. We're gonna have a conversation. And then I follow the thought through and get to the point of, okay, even if worst case scenario happens, I can be okay. I will get through this. So I don't have time to be worrying about this right now. I'm going to go and do these things. I'm anxious. I'm going to go take care of myself instead of sitting here worrying and going down this rabbit hole. Now, I know I said it's hard, easier said than done, right? So you have to recognize I'm anxious. Oh, I'm in my head. I'm buying into an old anxious narrative that's a lie. How can I take care of myself and be more compassionate, be kinder to myself to help me move through this moment? Oh, y'all got some, what is this, Swedish? I sadly only know how to speak and read English. I'm going to blame it on my Texas public school education. You're welcome, Linda. Did everybody have a good weekend? Or was it hard? I know weekends can be hard for folks. How was y'all's weekend? I want what I'm eating. I'm eating potato chips and a sandwich. It's usually my Monday staple. It's easy to throw it together in the kitchen and sit here and come eat with y'all. Mm. Nah, am I saying that right? Probably not. Not an amazing weekend. Mm. I'm here with you on that. Mm. Okay, so Kansas City Chiefs won. I didn't watch that game. I do love Patrick Mahomes. Um, so I guess that means I like Kansas City. Um, my favorite team is the Baylor Bears, though. Linda had a really hard weekend. Ugh, I'm sorry, Linda. Caffeinated sloth hard, but you pushed yourself on your meal plan. Congratulations, everybody! Give the caffeinated sloth some High fives, thumbs up, way to go. Yeah, a lot of y'all are struggling. I can see that. Ugh. January feels like a hard month, doesn't it? I'm saying that because I know a lot of my clients are saying that. I know I'm proud of everybody here eating and hanging out with us. Hmm. Americans on and potentially non-Americans who watch world news. How's everybody feeling about this week? Please don't, this is a recovery safe space, but that means feelings are okay here. So 2021 is a hard fucking year. It's forget 2020. 2021 is terrible. Terrible. It's been hard. It's been hard. And it's been hard for a lot of y'all too. Um, I hear that. And as a therapist, I think that's hard to admit. I wish that I could like offer some kind of advice to make things feel easier. Um, but I don't. Things are just hard. And so, what we say in my house, we're just feeling it. We're just in it. And if anybody else who's in it, we're we're in it with you. Yikes. Yep. 2020 was hard, and 2021 is still hard for a lot of people too. So I got really frustrated with folks who came out,